Straight ahead on Health Pulse. The University of Utah is ushering in a new era of patient care, compliments of a $200 million expansion project. And if you live in a small town, getting the highest quality medical attention can be extremely challenging. But not anymore. How these robots are saving lives and time. Those stories and much more are coming up next on Health Pulse.
Hello and welcome to Health Pulse, a TV show dedicated to helping you live a happy and healthy life. I'm Buddy Blankenfeld.
And I'm Brandy Vega. The University of Utah Hospital is ushering in a new era for patient care, thanks to the completion of a $200 million expansion project. You are looking at the new lobby geared towards helping patients and family members feel like they are in a healing environment. The new project also includes 100 new private patient rooms, allowing family members a more comfortable stay alongside their loved ones. Plus, getting in and out of the hospital will be much easier thanks to 250 additional parking spaces. The services patients need most, such as information desk, admitting, and cafeteria, are now all located near the front entrance. The first phase of construction included the Eccles Critical Care Pavilion, which greatly enlarged the hospital's emergency, surgical, intensive care, short stay, and post-operative care facilities, in addition to providing new surgical suites. The second phase of construction features a 2-story addition to the Critical Care Pavilion, a 4-story parking addition to the parking terrace, and the new 7-story patient care pavilion taking care of women's and children's services, along with cardiovascular and neuroscience services.
Part of the university's new expansion project is the integrated EP MRI lab. It's the first and only lab of its kind in North America.
As a scientist and an ablationist or a cardiologist, it's a heaven for an operator.
Dr. Nasir Marouche, an electrophysiologist and director of the university's atrial fibrillation program, has conducted the most extensive studies to date on the use of novel MRI techniques for treating atrial fibrillation. This new facility will accelerate the university's groundbreaking advances in the diagnosis and treatment of AF using MRI. AF is a heart rhythm disorder affecting more than 3.5 million Americans, killing more than 66,000 people each year. The new lab is a multidisciplinary partnership between University Hospital, the university's Division of Cardiology, Department of Radiology, Scientific Computing and Imaging Institute, and the Utah Center for Advanced Imaging Research. It features this, an 18,000-pound Magneton 3T Vario. The 3D imaging offers some of the most advanced magnetic resonance imaging services clinically available.
We, with this new lab, would be extremely safe because it would tell us exactly what we did in the heart by telling us how accurate our lesions, and if we damage anything else, we see it online, we can act immediately and avoiding any future complications.
Adding state-of-the-art technology is just one way University Healthcare is expanding its cardiovascular services, along with hiring 5 new cardiologists.
The doctor from miles away will see you now through a robot. Across the nation, hospitals without stroke experts on staff are using telemedicine technology to connect stroke patients with these specialists. With a fully mobile, remote-controlled robot, a patient can interact live with a specialist miles away through an LCD screen and camera on the robot's head. The specialist can then determine the type of stroke and recommend the best course of treatment. David Miller suffered a stroke at only 51. Although his local hospital didn't have a stroke specialist on site, they were able to connect him to an expert in the Michigan Stroke Network via a robot on site at their facility. Mr. Miller received timely treatment and had a successful recovery. Today, he is living with little disability and is keeping up with his 2 teenage sons. He credits his recovery to the robot, the trained staff, and the treatment he received. Stroke is the leading cause of disability in the United States and the 3rd leading cause of death. Soldiers wounded on the battlefield no longer have to wait for a hospital for treatment. This is their flying treatment facility called MERT, or Medical Emergency Response Team. On board, a highly specialized medical team made up of a doctor, nurse, and 2 paramedics. These experts are trained to treat serious injured people in the area of operations. Today, the medical team is responding to a blast northeast of their base camp in Afghanistan. Once the teams land, they do a quick survey of the casualties and injuries. Next, they load the sickest patients closest to the doctor and the more minor injuries to the rear. Then it's time to hit the skies and the critical care begins. They administer strong painkillers, anesthetize patients, do surgical procedures, and even give blood long before the injured reach the hospital.
No! If this is your toddler's favorite word, you are not alone. In fact, it's a good thing and a major milestone in healthy development. While no can be annoying, these behaviors show how a toddler's brain is developing by forming new connections between cells. According to Dr. Jean Barrison, head of child psychiatry training at Massachusetts General Hospital, toddlers are trying to figure out how much power they have over the world around them. Their growing brains let them see and understand things differently than they had even just a few months before. That makes me feel a little bit better.
So does that mean my 2-year-old is going to be a genius? Because that is her favorite word.
Well, I say no all the time. Am I a genius?
No.
Exactly.
Well, still ahead on Health Pulse, this is no ordinary baby. Take a closer look. She has 2 complete faces. What went wrong and why many people believe she's a god.
Utahns in need will now be able to eat a more healthy diet. We have the much needed improvement to the WIC program, how you can get help if you need it.
She's been training to become a business professional, and now she's taking an accelerated course in advanced glamour. After the break, watch how our fashion divas teach this busy single mom the tools of their trade. These stories and much more next on Health Pulse.
It's hard to imagine a time when sunscreen wasn't commonly used, but it's true. So for today's mind-bender question, who invented sunscreen?